Rethinking Antithrombotic Therapy, the Aquatic Trial. The Aquatic Trial, presented at ESC Congress 2025, published in the New England Journal of Medicine. It tested adding aspirin to oral anticoagulants, OAC, in patients with chronic coronary syndrome and prior stenting. All were at high atherothrombotic risk. The results? Aspirin plus OAC led to higher risks: cardiovascular death, myocardial infarction, stroke, systemic embolism, revascularization, acute limb ischemia, all-cause mortality, and major bleeding. The trial was stopped early. So what did Aquatic teach us? Strong evidence against routine aspirin use in CCS patients on long-term OAC, a clear warning about bleeding risk and worse cardiovascular outcomes, and data that will shape future ESC guidelines. 1. The role of aspirin. After PCI experts emphasized, stopping aspirin early after PCI, then continuing OAC plus a single P2Y12 inhibitor, works better. Aquatic tested aspirin use beyond 6 months. That's where clinical controversy remains. 2. The paradox. Why did aspirin actually increase cardiovascular events? Possible reasons: bleeding complications, treatment interruptions, limited ischemic benefit in stable CCS, patient frailty. This highlights a mechanistic gap that needs more research. 3. Alternatives and dosing. Aquatic used standard aspirin dosing. But what about clopidogrel, or lower personalized doses? Those questions remain unanswered. 4. Generalizability. The trial studied mostly older male European patients with comorbidities, so can we apply these findings broadly? That's still unclear. 5. Early termination. The trial ended early, and about 10% of patients were lost to follow-up. This limits our ability to see long-term effects. 6. A hidden angle: GI bleeding and cancer, not discussed in Aquatic, but important. Large studies show aspirin-triggered gastrointestinal bleeding can sometimes reveal previously undiagnosed colorectal cancer or premalignant polyps. This means bleeding on aspirin isn't just a complication, it can sometimes be a warning sign. The Aquatic trial is practice-changing. It argues strongly against long-term aspirin in CCS patients on OAC after stenting, but it also raises critical questions: mechanisms, dosing strategies, alternative drugs, patient selection, and aspirin's broader biological effects. The message is clear: we must move toward personalized, patient-centered antithrombotic care, because in this field, one size will never fit all. Thanks for watching. Subscribe for more insights on cardiology, geroscience, and evidence-based medicine.